Thank you very much for calling. Yesterday on the program, late, we took a call from Jonathan Cooper from St John's Ambulance about a defibrillator that had been used out at Oak State on a man, which arguably saved his life, an automatic defibrillator. Now, he's brought into the studio to show me. Jonathan, good morning.
Good morning, Neil. How are you?
How long have you used these things?
We've had them in place for some years. There is a variety of providers. This is one from Laydell. We also have Cardiac Science. And we have these on our bicycle patrols and kits right around these events.
And they are totally sort of automatic, aren't they?
There is an automatic. This is semi-automatic. There are full automatic ones that will assist the patient with the pads on and shock them automatically without anything.
Well, we'll just set it off because it actually tells you what to do, doesn't it? And then we'll have a talk to the patient's doctor.
Just pull that, yeah.
Right, yes.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Right.
So there you
So
go.
it gives you a minute to do that, does it?
Yeah.
And it keeps going. Where's the paddles? They're in here somewhere.
No, the actual pads there that come out are
When patient's chest is bare, remove protective cover and take out white adhesive pads.
Oh, I see these adhesive pads. Yeah, I won't take it out because it'll waste one. And then it'll tell me what to do then.
Yep, once they're open, it'll say the
When patient's chest is bare, remove protective cover and take out white adhesive pads.
Why does it tell me to do that again?
Twice. Yeah, just do
Do I
it
have to
again.
take out the pad? No, I don't want to waste it.
I was going to say don't take out the pads because it is a
When
real one. It
patient's
might.
chest
Yeah, all right. Shut up.
remove
Just hit one.
protective cover and take out white adhesive pads.
There you go.
I think I've stopped it. I hope I've stopped it. Okay, but that's it. Takes you step by step. So use these on the bikes. What happened yesterday?
Chest
Hang on,
is
he's still
bare.
going with us.
Remove
In the situation, it guides you when you put the pads on the body itself.
Yeah.
It will assess the rhythm of the heart. If it's in a ventricular fibrillation or something like that, it will then it'll assess that and tell you it's about to shock patient, or it'll say push the button to shock the patient. In yesterday's case, I understand the bicycle division of St John Ambulance responded. They were first there. We had other volunteers come in. Just as he was being put on a bed to be loaded, they thought he might have had a stroke or something earlier. He had an arrest, and we shocked him once with this actual unit that you just saw.
So his heart had actually stopped.
It was in a VF arrest.
Yeah, okay.
So he had a heart attack. He was defibrillated.
Yeah.
And as far as I know, he was conscious and alert and taken off to the Royal Melbourne Hospital.
Now, previously, what would you have done? Would just be the whole CPR,
Would have been CPR.
which is not as effective.
It's not as effective, but the real thing that we're promoting through St John, and these public access defibrillators are available at the airports, you might have seen,
Yeah.
MCG. We're really promoting. We put one in the cemetery the other week down at Bunyarong. At a memorial chapel because people were high risk, high emotion, collapsing. So it's a real thing, and I think when these opportunities come up, it's not that it's good to have a heart attack, but a great save and a great outcome.
Well, we've got on the line Dr. Paul Spark at the Royal Melbourne Hospital, who was one of the doctors treating the patient who was helped out of the Oaks, or had the arrest out of the Oaks yesterday. Dr. Spark, good morning.
Good morning.
How's he doing?
I think he's doing really well. It's a testament to 21st century technology that we've got these wonderful devices that the public can use, as well as experienced operators like the St John Ambulance team. It's a great result, and he's doing really well and looking at having a bypass operation in the next couple of days, probably.
Oh, okay. So he's it would seem as if this has really saved his life.
Look, it has. I mean, as we've heard, this ventricular fibrillation, when the heart goes into a very chaotic rhythm, is often preceded by, a little heart attack or something like that. And you've only got a couple of minutes before you actually die, or the brain ends up sort of shriveling because it's very sensitive to a lack of oxygen and blood supply. So time is critical, and these devices can revert the patient back from a terrible heart rhythm problem back to normal very quickly within the course of a second or two.
Well, we've all seen the medical shows where the doctor in the hospital rubs some paddles together, says clear, and then puts them onto the patient. Is that what really happens?
Well, yeah, there's a big blue flash and a pile of ash. No, not really. But what happens
Thanks very much.
but the patient doesn't jump off the bed like in those various shows, but they might give a little twitch, and it's not as impressive as you see on all those emergency shows. But there is, basically a significant voltage between the two white patches that you keep getting asked to take out of their bags. And that sort of sets the heart back to a normal rhythm.
Okay, well, look, thank you for speaking to us. I know the patient isn't well enough to speak to us, but give him our regards, please. He's fascinated us all.
Absolutely, no problem.
Thank you for your time. Dr. Paul Spark, Royal Melbourne. Yes.
Sorry, Neil, just one thing. I just need to mention that we do obviously work very closely with the Metropolitan Ambulance Service and the VRC, so it is a teamwork approach, and I think that the whole effort yesterday from where it was to the outcome of the patient was fantastic.
And there's no blue fashion and pile of ash. I think we've established that. How many of them have you got?
We've got, I think, about 200 across the state.
How much do they cost you?
Just under $3,000.
Really?
Yeah. But I mean,
save a life.
It's a plasma screen, isn't it? It's really, that's what we say, it's a plasma, but it saves a life. And they're available, anyone can use them. You don't need to do a big paramedical training course. You can do a 2-hour course and put that in the boot of your car and save a life. That's what we're trying to promote, that anyone can have one and buy one.
Well, thank you for coming in, and good luck with it.
Thank you.
Jonathan Cooper from St John's Ambulance and Dr. Paul Spark from the Royal Melbourne Hospital with a sense of humour. And the machine, does it stop talking?
Stop talking now, it's okay.
Thank you very much.